Every 40 seconds, somewhere on this planet, someone has a stroke. By the time you finish this sentence, another brain has been hit. Every year, stroke kills almost 6 million people worldwide, ranks as the second leading cause of death globally, and is the #1 reason people end up with permanent disability. And here is the part nobody tells you clearly enough. In a very large number of cases, the brain gives you specific warnings hours or even days before the big stroke arrives. Warnings that feel mild, warnings that disappear on their own, warnings that most people dismiss as tiredness, stress, or just getting older. This video is about those warnings because stroke is not simply you were fine, then you fell, then you woke up in hospital. In most cases, stroke is the predictable end point of blood vessels that have been under pressure for years. And what happens in the 24 to 72 hours before a major stroke is one of the most critical and most misunderstood windows in all of medicine. My name is Dr. Adeyemi, and this channel is dedicated to bringing you the latest evidence-based research on senior health in a way that is actually practical and easy to use. If you have not subscribed yet, I would encourage you to do that now so you never miss what we are covering. By the end of this video, you will know exactly what the brain's warning signals look like, why they disappear, and why that disappearance is the most dangerous moment, and what to do immediately when any of them occur. This information could save your life or the life of someone you love. Stay with me. Before I describe the warnings, you need to understand what is actually happening inside the brain in the days before a stroke, because that understanding is what makes these warnings feel urgent rather than dismissible. Most strokes are ischemic. This means they happen when blood flow to part of the brain is blocked either by a clot forming inside a narrowed artery in the brain, or by a clot traveling from another location such as the heart and lodging in a brain vessel. The brain tissue downstream of that blockage stops receiving oxygen and begins to die within minutes if flow is not restored. But the majority of major ischemic strokes do not happen in one sudden event with no prior indication. They are frequently preceded by one or more transient ischemic attacks, which doctors call TIAs. A study published in the Journal of Neurology examined 2,416 stroke patients and found that warning signs of an ischemic stroke may be evident as early as 7 days before the attack. In 549 patients, TIAs occurred prior to the ischemic stroke, with 17% occurring on the day of the stroke, 9% the day before, and 43% at some point during the preceding 7 days. A TIA happens when a clot briefly blocks blood flow to part of the brain, causing stroke symptoms that last typically from a few minutes to an hour and then dissolves on its own. The brain recovers, the symptoms disappear, the person feels fine again. And that is the most dangerous moment in stroke medicine because when the symptoms disappear, most people do nothing. They assume the episode was nothing serious. They wait. They go to sleep. They tell themselves they will mention it to their doctor next week. And the same arterial conditions that caused the TIA produce a full stroke, often within 2 days. The 90-day stroke risk after a transient ischemic attack can be as high as 17.8%, with almost half of those strokes occurring within 2 days of the initial event. A TIA is not a mini-stroke to be observed. It is a medical emergency with the same urgency as a stroke itself. So, what do these warnings actually look and feel like? Warning sign 1. Sudden weakness or numbness on one side of the body. This is the most documented pre-stroke warning. It appears suddenly, typically on one side of the body only, affecting the face, arm, or leg, or all 3 together. The person may notice the corner of their mouth drooping. One arm may feel heavy or refuse to rise when they try to lift it. One leg may drag slightly when they walk. The hand may feel clumsy and drop objects. The critical word here is sudden. This is not the gradual achiness of arthritis or the familiar tiredness of a long day. This comes on in seconds without any prior warning, then may disappear equally quickly. That sudden onset and that one-sided pattern are the brain telling you clearly that blood flow has been interrupted in a specific region. If you notice this in yourself or someone near you, call emergency services immediately. Do not wait to see if it gets better on its own. Getting better on its own is exactly what a TIA does, and it is not reassurance. It is a countdown. Warning sign 2. Sudden difficulty speaking or understanding words. This one is often frightening to witness. A person suddenly cannot find the right words, speaks in garbled or confused sentences, or cannot understand what is being said to them, even though they appear alert. They may try to respond, but produce words that do not connect to the question, or they may understand what is happening, but be unable to form words at all. This pattern is called aphasia, and it results from interrupted blood flow to the language centers of the brain, which in most people are located on the left side. Like the weakness, it comes on suddenly and may resolve within minutes. Some people describe it afterward as their words simply disappearing, as if they knew what they wanted to say but could not find the path to say it. Sudden speech difficulty is one of the most reliable pre-stroke warnings in clinical medicine. If it occurs once and resolves, it must be treated as a TIA until proven otherwise. Warning sign 3. Sudden vision change in one or both eyes. This includes sudden blurring in one eye, a portion of the visual field going dark or gray, or a brief loss of vision in one eye entirely. Some people describe it as a curtain being drawn across part of their sight. Others describe double vision that appeared without any head movement or position change. Vision is processed in the back of the brain in an area called the occipital cortex, and also depends on blood flow through the ophthalmic artery that feeds the eye itself. Sudden vision changes in one eye specifically are associated with interruptions in the carotid artery blood supply on that side, which is the same artery pathway involved in many strokes. A brief loss of vision in one eye that resolves completely is called amaurosis fugax, and it is classified as a TIA affecting the eye. It is a warning of imminent stroke risk and requires emergency evaluation. Warning sign 4. Sudden severe headache with no known cause. Not all strokes are ischemic. Hemorrhagic strokes, where a blood vessel bursts inside the brain, often begin with a sudden, severe headache that most patients describe as the worst headache of their life. It comes on at full intensity within seconds, not the gradually building headache of tension or dehydration. This pattern of headache is sometimes called a thunderclap headache because of how instantly it reaches maximum severity. If someone you know develops a severe headache of sudden onset that they describe as unlike anything they have experienced before, this is a medical emergency that requires immediate evaluation. Warning sign 5. Sudden loss of balance or coordination. The cerebellum and the brainstem, which are structures at the back and base of the brain, control coordination, balance, and the ability to walk smoothly. When blood flow is interrupted in the arteries feeding these structures, a person may suddenly stumble, veer to one side when walking, or feel as if the floor is tilting. This is different from the familiar lightheadedness of standing up too quickly, or the occasional imbalance of inner ear problems. The sudden onset, in the absence of positional change or any clear trigger, and particularly when combined with any other warning on this list, is the distinguishing feature. If you have made it this far, you are clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Over the years in my clinic, I have seen one simple truth. Real progress does not come from doing anything extreme. It comes from doing the right small things consistently every single day. That is exactly why I created the 30-day blood pressure reset for seniors. High blood pressure is the single most important modifiable risk factor for stroke. It is the main risk factor for both TIAs and full strokes. Managing it consistently is one of the most direct things you can do to reduce the risk of the warnings I have just described ever appearing. This guide is a simple, step-by-step plan designed to help support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can easily follow at home. Some of my patients and people who have already gotten the guide have followed this exact structure and started seeing real noticeable improvements. Many have shared that they feel more in control of their daily habits, more confident about their blood pressure readings, and more at peace knowing they are finally doing the right things. I am only allowing 30 people through it right now because I want to follow up closely with each person. Click the link in the description or scan the QR code to get your copy before the spots are filled. And because you are part of this community, I have made it easier with a 70% discount. After you get your copy, drop your email, and I will personally follow up with you. Let me give you the most important practical instruction in this entire video. The acronym FAST is the fastest way to identify a stroke or TIA in yourself or someone else. Face drooping on one side, arm weakness, one arm drifting down when both are raised, speech difficulty, slurred or strange. Time to call emergency services immediately. But I want you to know one thing that goes beyond fast. When any of these symptoms appear and then disappear within minutes, the instinct is relief. Do not act on that relief. A TIA that resolves is not reassurance. It is the clearest possible warning that a larger event may be hours or days away. Research confirms that almost half of strokes following a TIA occur within 2 days of that initial episode. The correct response to any resolved TIA symptom is emergency evaluation the same day. Not a GP appointment next week, not a phone consultation, emergency evaluation. Brain imaging, blood tests, ECG, and vascular assessment should be performed within 24 hours of a TIA to identify the cause and begin the interventions that can prevent the full stroke. The treatments available after a TIA, including antiplatelet medications, blood pressure management, and in some cases carotid procedures, are most effective when started within the first 24 to 48 hours of the warning event. Every hour of delay after a TIA reduces the window of maximum preventive benefit. Before you go, think about this for a moment. Most people keep waiting for the perfect time to take their health seriously, but that moment usually never comes. That is exactly why I put together the 30-day blood pressure reset for seniors. It is designed to help you follow a simple, structured daily routine that supports healthy blood pressure without confusion or stress. Inside, you will find gentle exercises, practical daily habits, and a clear step-by-step plan you can actually stick to. Some of my patients and people who have already gotten the guide have followed this exact structure and started seeing real, noticeable improvements. Many have shared that they feel more in control of their habits, more confident about their readings, and more at peace knowing they are finally doing the right things for their health. I am keeping this very limited. Only 30 spots are available and 5 are already gone, which means just 25 spots are left. Once those spots are filled, I will close it. Click the link in the description or scan the QR code to secure your spot now. And because you are part of this community, I have made it easier with a 70% discount. After you get your copy, drop your email and I will personally follow up with you, checking in and helping you stay consistent with the plan. Tell me in the comments, have you or someone you know ever experienced any of these warning signs and not known what they were? I read every comment, and your answer shapes exactly what I cover next. Share this video. The person in your life who does not know what a TIA looks like, who would dismiss a brief numbness as tiredness and go to sleep, needs this information before that moment arrives, not during it. I am Dr. Favor Adeyemi. The brain does warn you. Now you know how to listen. I will see you in the next one. Disclaimer. Everything shared in this video is general educational information based on published neurological research, American Heart Association guidelines, and data from the American Academy of Neurology. It is not personal medical advice. If you or someone near you experiences any symptom described in this video, call emergency services immediately. Do not use this video to self-diagnose or to decide whether symptoms require emergency care. Every stroke symptom, even if it resolves, requires same-day emergency medical evaluation. Time is brain.